Welcome to our second Ardenwood Presents webinar this year. Today's presentation is on long-term care for Christian Scientists. We thank you for joining us. I'm John Mitchell and I serve as Executive Director and CEO of Ardenwood here in San Francisco on the second day of spring with the cobalt blue skies. It's a beautiful day here. You know, you are invaluable to Ardenwood. Your donations help to sustain our uninterrupted services, something we've been doing since 1930. And in return, we want to provide you with the best possible care and special events like this one. You truly bring out the best in us, and we thank you. By the way, our next event is our annual meeting, which will be presented online again this year on Sunday, May 1st at 2 p.m. Pacific. Please keep your eye out for an invitation via email and regular mail in order to register for this annual event. Warren Huff, Executive Director Emeritus of Cedars Camps in Missouri, will be our inspirational speaker. And the title of his talk is Bible-Based Rules of Healing to Apply and Prove Today. It should be wonderful. Now, before we begin, I'd like to share a few thoughts with you about today's topic, long-term care for Christian Scientists. You know, that sounds like an oxymoron, doesn't it? Like jumbo shrimp or deafening silence. Fidelity to divine principle always brings proofs of truth's triumph over erroneous beliefs. We know that. Long-term care suggests the exact opposite. So why are we talking about it? And why are we grateful that so many of you are here today? Because Christian Scientists are wiser than serpents. They're matter-of-factly prepared for moments that Mrs. Eddy refers to as inspiring discontent. That's a marginal heading in Science and Health with Key to the Scriptures. Christian Scientists make informed personal decisions. Just as important, they don't want to be a burden to their families, not physically, not emotionally, and not financially. So what is long-term care? Well, in spiritual terms, we might describe it as the proposition that we are forever in God's care. There's also a long-term commitment to behold the perfect man in ourselves and our loved ones and everyone. In the world's terms, long-term care is custodial care. It assists you with your daily life when you are unable to fully care for yourself. In this sense, Ardenwood is not a long-term care facility. It is not a nursing home. In today's world, we might say, there's no parking here. People come to Ardenwood because they want to be and expect to be healed. Healing is our primary focus. Financing care through Medicare and supplemental insurance helps cover these shorter-term needs while the patient is actively, metaphysically addressing the specific claims about their well-being. One of the most important first steps is to complete an advanced healthcare directive. You'll hear that a lot in our meetings, as you know, an AHCD, and let your family know what's on it and where it is located. You can find an example of one on our website at ardenwood.org. Click on About at the top of our homepage, and then on Healthcare. Scroll to the bottom of the page and find the link to the AHCD, or Advanced Healthcare Directive. Finally, the content shared today is only informational and is not intended to be legal advice. A replay of this presentation will be available on our website in a day or so. And now, let me introduce our presenters, Jim Maher, Katie Burris, and Lesleah Frisco. Jim Maher is a certified senior advisor and a broker consultant specializing in Medicare. He's been helping individuals and companies navigate Medicare since 1989. And he frequently speaks to law firms, CPAs, medical groups, school districts, Rotary clubs, as well as large and small companies. Jim is also a certified long-term care insurance strategist. He specializes in helping human resource professionals with their Medicare questions regarding current employees and how Medicare integrates with retirees and COBRA. Jim and his wife of 36 years, Teddy, live in Lincoln, California, just north of Sacramento. Katie Burris is a Medicare specialist and certified long-term care consultant, helping individuals with their Medicare and long-term care planning strategies. Katie is a partner at McGrew and Maher Insurance Services and has been in the business for 17 years now. She is licensed for life insurance, long-term care, and Medicare in several states. Katie's married to her high school sweetheart, Brian, and they are busy with their 2 daughters and 3 dogs. Finally, Lesleah Frisco is Ardenwood's Director of Christian Science Nurses Training. Leslie graduated from the Mother Church's Christian Science Nurses Training Program and has been a general listed Christian Science nurse since the late 1970s. One of Leslie's previous responsibilities was to work with Medicare to ensure proper coverage for our patients who choose to use their Medicare benefit. In this regard, she is an unsung hero for her diligence and competence in wading through the intricacies of Medicare. As you know, if you have any questions, click on the Q&A icon at the bottom of your screen, and another screen will appear and you can type in a question. Please submit it, and it will arrive here, and only we will see those questions. We will save them for the end of the presentation. Please, won't you join me now in welcoming Jim and Katie and Leslie.
Hi, everyone. Thank you so much for having us. He is Jim Maher. I'm Katie Burris. And we'll be talking about long-term care.
And Leslie Frisco. Yes. And hey, John, thanks for the nice introduction. I just wanted to say one thing too. We love working with Christian Scientists throughout the United States. Today, since I grew up in a large Irish family in the Bay Area, I thought I would use a lot of personal examples. I've seen family and relatives deal with this type of care for 33 years. So I'm going to talk, I have plenty of examples in my family, including myself. So I'm going to talk about some of the personal things today.
So when we talk about long-term care, we often tell you that it's not a place or a condition, but it's rather a life-changing event. John did a good job talking a little bit about what long-term care is. So when you're working, if you cannot work anymore, they say that you're disabled, it's you can't do your job. But when you're retired, they have to have another way of being able to say if you need care. And that's if you can't perform some of the activities of daily living.
Right. And I think it's easiest to look at these as when somebody gets up in the morning. I think that's a way. Like Katie said, when I first started this, I go, how do you tell if somebody's disabled, right? When you're retired, if I can't perform the substantial duties of my occupation when I'm working, okay, I'm disabled. But what if I'm retired? What if I don't have any occupation? Well, this is kind of the way to look at it. I think it's the easiest to explain. So when you start off, Katie, in the morning, right?
You get up. So transferring in and out of bed, in and out of a chair. If you need to go to the bathroom, bathing, dressing, eating, things like that. And then also if you have a cognitive impairment.
Right. And what we mean by if you can't do that, or if you need some type of even standby assistance in the insurance world, for example, I'm going to talk about my father a lot today, who passed away at 102 years old, led a great life, great Christian, helped a lot of people, and God blessed him with a very long life. But towards the end, he needed some practical assistance with getting out of bed, right? Transferring or out of a chair. So if my dad couldn't do it, if I'm standing by, right, in the insurance world, that's the same as saying he needs assistance. If my dad was trying to take a shower and I was standing by to make sure he wouldn't slip, and by the way, he didn't want me there, but I didn't want him to fall. So the insurance world looks at saying, well, he needs assistance now with bathing, even though I'm physically not touching him, if I'm there just in case. In the insurance world, they go, if you can't do 2 of these 6 activities, right, or you have a cognitive impairment, whether it's dementia, Alzheimer's, or something like that, then they go, you're disabled. And if you're in the insurance world, that would mean you can access the benefits to your policy.
So long-term care planning is really about protecting your most important asset, being your family.
We should have had a quiz because everyone's going to say money, right? It's all about your family. It really is. It really is about taking care of your family.
So a lot of people want to know, well, what is long-term care insurance? And really, long-term care insurance is a policy that would provide a tax-free income stream to cover long-term care costs should you need it. The policy covers you at home for like a home health aid or home modifications, which I know a lot of people don't know what that is.
Right. That's super. I'll just go up. That's super important. I see sometimes people, if they are, for example, in a wheelchair and they come home, well, you may need to widen doorways. You may need a ramp, for example. You may need to pull carpets. So if you have the right type of policies, you can be covered for that. Grab bars. I know my dad always needed grab bars. We put in grab bars. So all these types of services or modifications can be covered by the proper insurance.
And then depending on the type of policy, it could also cover care that's provided by family members, loved ones, neighbors even. And then they would cover you in an accredited facility or an assisted living facility as well.
And we want to go over that in a second. It's really important. Indemnity really means it's indemnifying you for that benefit. So basically it's a cash benefit, which I really like. I like being able to have the monies and do whatever I want to do with them once they call it triggering the benefits, access the benefits. If I want to take a trip to Hawaii, if I want to pay my grandchildren to mow my lawn, if I want to help my adult children, I can do whatever I want with the monies. There's no restrictions. And Leslie, I think this would really be a good opportunity. We get asked a lot too about the difference between an accredited facility, right? Such as Ardenwood, for example, and we know it's not considered a license by the insurance industry.
Okay, so Ardenwood is accredited by the Commission for Accreditation of Christian Science Nursing Facilities. So for skilled care purposes, we're accredited. For Medicare, we are certified for Medicare Part A, but we are not licensed by the state as a nursing home. So that's just a little distinction. So sometimes insurance companies will recognize it and sometimes they will not when it comes to long-term care.
Okay.
So with a long-term care policy, a lot of them will cover instrumental activities of daily living. We like to think of them as the practical side of life.
Yeah.
So they cover you for things like shopping, if you need someone to do your shopping, or transportation. Someone needs to do some cooking for you, laundry or cleaning, or even if you need some help with bill paying as well.
Right. So now I'm going to introduce you to my mother-in-law, right? So I love my mother-in-law. She's awesome. I always tell her she's my favorite mother-in-law. And she really is a great person. She had a long-term care policy years ago. And her financial advisor told her out financially that wasn't maybe the best idea. And she ended up canceling that policy. It lapsed, okay? It's no longer. And unfortunately, right now, she needs care. So she's moved up here in a place by my wife and my sister-in-law provide a lot of her care. Because if we had that policy, they could simply supervise the care and not provide care. But my mother-in-law really needs help with practical everyday things, right? She can't go shopping because she would have a tendency to buy the same thing over and over. But so they do her shopping. She can't go to the doctor, so they take her to the doctor. They're afraid that she's going to cook, right? Sometimes, as you age, sometimes you may forget to, leave a burner on or something like that. So they do pre-cooked meals where they can warm in the microwave. Some light cleaning and laundry, things they really don't want to do, but they do it because they love their mother, quite honestly. But it would have been great if they had that policy, but unfortunately, that just, it's gone. And now we just have to deal with some of the practical sides of taking care of somebody like my mother-in-law.
So as a Christian Scientist, you expect a long life experience, and planning for it is definitely a necessity.
Right.
I think a lot of Christian Scientists just assume they're never going to have a challenge. They're never going to need it, but we don't know. So better to be prepared and not need it than not.
Absolutely, Leslie. I totally agree with you. I was going to mention my father passed away at 102. And it was interesting because he really didn't need a lot of care until kind of his late 90s. God really blessed him with an incredible life. He really was a good person. But things eventually start to happen, right? It just I remember he had some colon cancer, and this is at 99 or 100. And the surgeon told us, well, eventually, Jim, some things just wear out. It just happened. So he did need help, Leslie, with the practical side, right? And more than that, with eating, bathing, dressing. But he did live a long life, and the last couple of years were definitely a bit of a struggle for sure.
Mm-hmm. Mm-hmm. So with long-term care planning, there's really 3 different ways to pay for long-term care. If you don't have a plan in place or you don't have any sort of insurance, then you're going to self-fund. So you're going to have to decide when you need care, or if you need care, what assets that you set aside. The problem is a lot of times it creates what we refer to as a cash flow crisis, because you now have to pay for the cost of care.
That's right. You know, another story, I might have shared this previously. I've got some relatives in the Bay Area, and one was in a memory unit and the other was in the full-blown nursing side, right? They were in their early 90s, maybe late 80s, early 90s. And it was amazing. They were paying over $25,000 a month. And you go, well, okay, it kind of sounds like a lot, but until you start writing checks for that, I mean, that was my cousin, their daughter had even talked to me before about, planning their Medicare. And I said, everything was fine with Medicare. And she goes, well, why didn't we do any long-term care planning? I go, well, they did. They decided to self-fund, which is fine. I mean, I don't think it's the greatest plan, but it was a plan. They had properties in the Bay Area that I can't even believe what they paid for them, that were $25,000, $50,000 properties that turned into $1 million, $2 million properties. Well, guess what? They had to sell one. So my adult cousin is like, we don't want to do that. And I said, well, yeah, it's your parents' monies, right? And you're going to have to. And she said, but we don't really want to. 2 of the siblings agreed that we should. That's mom and dad's assets. So unfortunately, they ended up selling a highly appreciated asset. They had to pay a huge capital gains hit, and they were worried about selling a second property now over in the Santa Cruz area. So it's unfortunate, but they did have a plan. But sometimes adult children go, listen, I don't like that plan because, bottom line reality is, hey, they're spending my inheritance. It's kind of what it came down to.
The second option becomes Medi-Cal or Medicaid. So in California, it's Medi-Cal. Most other states, it's Medicaid. So this is what happens when you used your money or you don't have the money to pay for long-term care. And it really takes all control from you. So it's not a bad thing as far as it helps you with the cost, but you don't get to decide when and where you get the care anymore.
Right. And Leslie, we know that, go ahead. Medi-Cal
I was just going to say Ardenwood does not participate with Medi-Cal, neither do any of the Christian Science facilities in California.
And that's important. So you would really take that off if you intended on going to a Christian Science facility. That's not an option then. It's either going to be self-fund or turning to some type of an insurance product.
So with insurance, with a long-term care plan, most everyone thinks of the traditional plans, that the use it or lose it type plans, but there are many different types of plans available now, and it allows you to transfer the risk to an insurance company.
Right. I jokingly always say, okay, who wants to buy a long-term care policy? Raise your hand right now. And nobody does, because you think of, listen, I pay my car insurance, my auto insurance forever, and I hope I never have to use that, right? We all do. Same with my homeowners. I've been paying that. We're going to pay on that forever. I don't think I've ever had a claim or a real tiny claim like that. So I think people look at long-term care as, gee, I hope it never happens to me. So why would I want to pay a premium to an insurance company for the rest of my life to something I think is never going to happen to me, which I totally understand.
Mm-hmm.
But we have good news today, right? We're going to talk about, we do have good news. Okay.
So with long-term care and retirement planning, a long-term care plan should be in every sort of retirement plan.
Right.
But what we see is most retirement plans leave that out. They haven't planned for that. They haven't talked about that. So they're not prepared for that long-term care event. And again, we will, till we're blue in the face, tell you that Medicare does not cover long-term care. That's important to know. Absolutely.
Right. Especially for, I know we have some non-Christian scientists too, but that's so important because adult children assume that mom or dad, if something happens, they call all the time, they're going to be covered under that Medicare, Medicaid, Medi-Cal, whatever that thing is that they signed up for, they're going to be taken care of. And when they find out it doesn't cover them, I mean, a lot of them get upset. Well, why doesn't it cover them? Well, that's how it is. Well, no one's ever told them. It's really hard for a lot of, parents to have that talk with their children, their adult children, and saying, this is what my plans, especially when they don't have a plan. Because we figure a lot of people, they don't have a plan. My mother-in-law used to have a plan, and that little puzzle piece now is taken out of there. And the plan now is us, providing the care.
So when you're providing care, a lot of times what we see is when you're providing care to a chronically ill person, it makes the caregiver chronically ill as well. So we've had that happen with a lot of clients.
Yes, we have. One of my best friends, I was helping his mom for years down in the Bay Area. And she, second marriage, and she married this guy, Bill, and he was a lineman for like AT&T, big guy, like 6'4", 220 pounds, great health. I mean, he was in really big guy and in great shape. And he had a massive stroke. I mean, really out of nowhere, right? I know strokes come out of nowhere, but he thought nothing's ever going to happen to me. And he was probably at that time about 70, 71, somewhere in there. I don't remember the exact age. But bottom line, he became so incapacitated, and Fran loved him so much, they got a hospital bed and put it in their front room. That became their caregiving center. She stopped everything and did everything for him, second marriage. And it's kind of interesting because she's a very loving person. She gave up her bowling. She gave up all her other social activities to just focus on taking care of Bill. The problem with that is she drained herself so much that her cancer actually came back. And the doctor thought it was due to all the stress and the constant worry and worrying about Bill. So I've seen that. I mean, I've got 50 other examples I could share about what happens to the actual caregiver, right? That's why respite care is so important for caregivers, that they can actually get some type of a break, something.
Well, and for family members to be able to stay in the role of a family member and not a caregiver is just a really nice, important thing.
Leslie, that is huge. That really is, because you want to be able to, Katie and myself, we used to talk about supervising care, right? It's so much easier to supervise care than have to provide care, especially for an adult child.
Yes.
Yeah.
I know with your wife, when she is trying to help care for her mom, it's very hard when that relationship changes, because she feels like she's being talked down to and gets
That's
upset.
exactly right. Right. It becomes role reversals, right? She's saying, listen, now we need to shower. We need to, get dressed. We need to eat. It's kind of role reversal. And that's very hard. My dad used to treat me all the time like I was like 13 years old. Call me Jimmy, I don't need to do that. Or he would talk to me, but it's very hard to flip those roles.
And so it's easier when you're just getting to supervise the care, and you don't have to be the one to tell them what to do, because they don't listen to you like they do other people, for sure. So providing care a lot of times can cause issues with adult children, and it doesn't bring them together. It really a lot of times tears them apart, because they have different ideas of how the care is going to be handled, who's going to provide the care if there's not a plan in place, and also what money is going to be used.
So let me continue on the story about Fran and Bill, since I talked about Fran and Bill. So I have my best friend, and he had a sibling and his children. And the problem with Bill's children is they didn't have many assets, and Bill ran out of money. So then they turned to Fran's side and said, well, let's start using Fran's money. And guess what Fran's adult children said? Why would we want to use our money, our inheritance, right, Mom, to take care of Bill? And then they had the conversation with, listen, that's not your money, that's my money, and I'm going to choose to take care of Bill with that, which she did. Problem is, it creates animosity among those siblings. I mean, they couldn't even get together anymore. They just couldn't. And his sister was upset because he said that to his mom, and all because Bill chose not to do something about planning, really. Even if it was self-funding like my cousins, at least have some kind of a plan.
So if you ever need care, it's not that your life is going to end, but it's really that someone else's lifestyle is going to end.
That's right.
So when we talk about the circle of care, and we've already kind of talked about this a little bit. So the care recipient being the individual that needs care, whether that's due to a physical or a mental need. And the primary caregiver, like with your wife and her sister, are the adult children in this case. So they're providing the hands-on and financial care. And then you have the secondary caregiver, a lot of times being adult child that lives out of state or out of the area, or it could be in what I've seen a lot of cases where you might have an individual that needs care and then like a sibling that visits and can help here and there, but doesn't have the, financial or capability to help full time.
But they're great at critiquing your care. I've noticed that too. They're great at telling you, gee, you should be doing this and doing that. I'm like, okay, well, chip in. Come on, you can help too, right? But it's hard.
And then you have the community support, friends, neighbors. The issue that we see here is a lot of times when you start to really need that care is friends and neighbors want to visit. They don't want to have to provide care to help out the primary or secondary caregivers.
We had a really good family friend whose name was Dick. And Dick lost his wife probably 7 or 8 years ago, and he was in San Jose, and Dick was in his probably late 70s then. And we kept saying, Dick, he didn't have any family. You should come up here. We've known him forever. He was my son's godfather. And so you should come up here and we'll help and take care of you. Well, he realized when some of his friends, there were 5 or 6 guy friends that he had, when they started needing care, you know what they all told him? Where's your family? Right? Where are your friends? Where's your family? Well, I thought you guys were going to help take care of me. No, that's not how it goes. So ultimately we had him come up here so that we would be able to support him. And we did, actually, we love that, right? He's a great guy, but I think a lot of people assume, gee, my friends or some of my neighbors are going to help take care of me. And normally that's, they may try, but it just doesn't work out because normally they need some more assistance.
Well, and a lot of times if you're relying on a friend or a sibling, they're of similar age. And so a lot of times they're needing care along the same timeline you are.
It makes it tough on everybody. It really does.
So if and when you need care, there's some really important things to consider. Where do you want to receive care? So do you have a plan? Is there someplace that you want to be? Have you made that known to your family or who is going to be in charge?
Right. And I just want to interject here from talking to so many Christian scientists, John and everybody, they absolutely love Ardenwood. So a lot of people's plans, and we talk to people throughout the United States, and you've got fans throughout many, many states. And the answer is, well, I want to go to Ardenwood. And it's like, well, does Medicare cover me there? And I'm going, well, call Leslie. So Leslie can talk to you about that, how it works. But a lot of people's plans are to spend time at Ardenwood. That's what we're told. If something happens to them, they want to be able to go there, Leslie. And
well, I think, Jim, it's helpful if they're writing this in part of their estate plan, and I've seen this done where they actually name a facility, it's wisest to say in a Christian Science nursing facility. It may be that Ardenwood is not able to admit them at that point. And I've had a conversation with family members that will say, no, this is where she wants to be. And it's like, but we can't. And so these are other options. So just to be a little more general with that, or would prefer Christian Science nursing care.
Okay. Yeah. I just keep say call Leslie or John.
The other important thing is, who do you want to provide care? Do you want a family member to provide care? And then do you want to have a policy that can pay them? I mean, we had a client a few years back where his idea of long-term care was he was going to move in with her daughter and her family, and his daughter was going to take care of him. But he never talked to his daughter about that.
Right.
And so when he needed care, she was not in the position to be able to care for him. And he was upset, but they never had this conversation. So she had no clue that that was his long-term care plan.
I think I see that all the time. It's a lack of communication because it's a really tough subject to bring up. Nobody wants to sit around and say, well, if something happens to me, are you going to take care of me? Right? We know adult children do it out of love, right? You do it out of love for your parent or parents, but who's going to provide care? Listen, I love my father to death. He's one of the greatest men I've ever been around, and I admire him, incredible person. But listen, quite honestly, I don't want to do those personal hygiene things, right? That was my dad. My dad was so stubborn that he decided back in 1991, my mom actually took out a long-term care policy because I think they wanted to help me. I was in the business a couple of years, but my mom actually needed the policy. My dad said, it's never going to happen to me. It won't. And then he would be 75 or 80. He goes, I'm getting too old. 85, 90, don't need it. When he finally needed care in his late 90s, he's going, we should have got one of those policies, huh? I go, yeah, we should have. But
we're about 40 years too late.
Right, about 42 years too late. But his idea was simply, well, I had assets. My father had an apartment house in San Jose, one small 4-unit, but he built it. That was his idea. Well, we'll just sell that, right, and use it for care, which I was fine with, but my sister did not like that answer whatsoever. So who provides care? Most of the time, it's your adult children, because they do it out of love for you.
Another important thing to consider is who's going to pay for that.
Right.
Do you have that plan in place? And then how it's going to change your family dynamics, because it just will if they have to provide care for you.
Yeah, yes, it does. It changes all the examples. I mean, I've been doing this since 1989. I've seen it so many times. It absolutely changes family dynamics. You see that one sibling is saying, hey, well, I don't want to do this. It's mom and dad's money. And the other two are saying, no, you need to do it. Don't worry about the inheritance. It's their money. It changes, right? It creates animosity. Even with my sister, it was tough. She's still upset at me at this day that we had to use dad's money to take care of dad, what it was for. She didn't like that. You know, and it does. It changes. I don't hold it against her, but she holds it against me, quite honestly.
So the monthly cost of care, and we used the San Francisco Bay Area for this example, where Ardenwood is located. So if you need like a home health aide for 44 hours a week, that would run a little over $7,000 a month. And by 2031, that's projected to be about $9,600 a month. If you need an assisted living facility and a private room, you're looking at $6,300 versus almost $8,500 in 2031. I want to point out those numbers right there. You will see that this is why some people end up having to go to a care facility, is because it costs more to get care at home. So that's why some people prefer a long-term care policy to help pay those costs so they can stay home if they want to.
Right.
And then a nursing home private room runs right now about $14,000 on average, and it is projected to be almost $19,000 by 2031. And when we talk about long-term care costs, they are going to be in addition to, not instead of, your current expenses. So if you need a home health aide to come in, that $7,000 is in addition to your current expenses, your house expenses, and all the rest of it.
Right. That doesn't go down. People are assuming, well, my spouse, I'm going to use less power, we're not going to use as much food, things like that. And you find out sometimes it's just the opposite, that you do spend more. One thing Katie and myself were talking about, when we did the 2031, we stopped, because when we looked at 2041 and 2051, the numbers are almost unbelievable, right? You can't.
They're a little scary.
They're scary. And people really didn't think much. We would talk about inflation before. I always say, you want to have some type of inflation protection on your plan that helps keep up with inflation, some type of cost of living adjustment. And until this last year, people really never paid that much attention to it. Now they're going, I get it.
That's
get
the new
what,
buzzword.
right? What it does. But I'm telling you, in 2041 and 2051, and more people are living longer. And when things happen, it's going to be so much more expensive.
So we talked a little bit about traditional long-term care policies. So these were the type of plans where you pay the premiums forever. And the premiums were not guaranteed. So what we're seeing now is we're getting calls on a weekly basis from people saying, my long-term care company is sending me a notice saying I either have to take a big rate increase,
right,
or I'm going to have to decrease the benefits that I've been paying for.
Right. They don't know what to do. And we've talked to numerous Christian scientists across the United States that have policies, from Mutual of Omaha, John Hancock, MetLife, Prudential. There's a lot of them. And all of them are taking these massive rate increases. And quite honestly, the departments of insurance are allowing it, saying, listen, the only way we can maintain this block of business is if we increase the rates. So seniors, people have been on the plan some 10, 20 years now, are going, well, the only way I can maintain this is I need to decrease my benefit, because that's going to lower my premium, right? It's going to I shouldn't say lower, it's going to keep it to where it is, or sometimes it's even 10% higher. Out here in California, we have CalPERS. CalPERS is the leader in long-term care plans. I mean, they've wrote written more policies than almost anybody. They've had like 10 or 12 rate increases. They just had a huge settlement. And we've got a lot of, not clients, but referrals that come in and say, what do I do with this policy? I mean, you talk about a dilemma out there going, I can't afford it, but I can't afford not to have it. So we have to try and figure out, okay, instead of the policy paying for a lifetime or 8 years or 6 years, maybe can you do it for 2 years? Me personally, I actually think a lot of the insurance companies want these people to drop the policies after they've had them because they know these claims are coming, right? Sooner or later, they're coming. So it's very difficult. They're afraid, they're scared. Their adult children do not want them to drop the policies, but quite honestly, you're looking at paying, your bills or rent, and it's tough. You've really got to balance it.
A lot of these plans, most of those plans were use it or lose it type policies. So my father had a long-term care policy, an old policy like this, that he paid into for 16, almost 17 years. And when he passed away a few years ago, he never needed the care. And those premium, we didn't get them back. They just kind of like your auto insurance and your homeowner's insurance. And so my mom asked after he passed, like, is there anything we get from the policy? And unfortunately, there wasn't.
There wasn't.
Because
and Don was Katie's dad. It's my business partner. That's how we started. So Katie's like my daughter. I think she's my daughter. But that's exactly right. I mean, if it was sad saying, well, what do I get with that policy? Nothing.
Yeah, they don't reward you for not using their product at that point.
That's right, Leslie.
You're paying for other people using the insurance.
That's exactly right. That's exactly right. Yeah.
So we have been, mostly Jim has been on the hunt for CIS friendly plans. So we're using a lot of long-term care plans right now that are life insurance plans that have those long-term care benefits built in, because you can leverage your money, and we will use that phrase. You'll hear us use that over and over. They're not your parents. So they're not like the long-term care plan that my dad had, and they offer tax-free benefits. And you can use the money on those indemnity type plans we talked about for any type of care and wherever you want to use it.
That's exactly right. And remember, tax-free benefits, tax-free death benefits, right? We're going to talk about a policy that we recommend a lot of time. But those cash plans, the indemnity plans are my favorite. Or even on the life insurance policies, there's ways to access money in those policies that you can use for tax-free, right? To stay home or have a loved one come in that's not a licensed provider, but somebody that's caring for you.
So asset-based long-term care policies are really awesome in the fact that if you live and need the care, then you have the coverage. It's about 3 to 4 times or even more the amount of money you put in that you would have to use for long-term care when you need it.
That's right.
If you decide to cash in that you don't want the policy, you can get most, or in some cases, all of your money back. And if you pass away without needing the care, then your beneficiaries receive a tax-free death benefit. So if my dad had had a policy like this, we would have received a tax-free death benefit.
That's right. So you always, when I was showing, my sons work with us, and when my son started looking at asset-based long-term care, he's like, well, why doesn't everybody do it? And I go, well, it's right. It's a personal choice. But he goes, well, if you need care, so if you put money in, you can get 3 or 4 times. And by the way, with cost of living riders we put on those, I've seen people turn 100,000 into 600,000 or more when they need care in their 80s, right? Because you can increase every year, the value increases. But it's like, so I can get more money, but if I decide I don't want it for some reason, some of the policies here in California, we've got one company where out in the 6th year, you can get all your money back. So I'm like, well, if I don't want it, I can cash it in, but that's when you really need it. Mm-hmm. But the biggest one is if you never use it, you're going to get a tax-free death benefit. And
that death benefit is going to be, in most cases, greater than what the premium that you put in.
Almost always. And let's use the example. What if I had $140,000, death benefit, and I used $40,000? Well, they would say, listen, we're going to take that $40,000 that you've used and subtract it. So now your loved ones, your beneficiaries, are still going to get $100,000, right? Better than I had to tell Katie's mom, you don't get anything. There are no monies coming. unfortunately. So I love these plans. I think they make total sense. And Stephen, my son, was saying, well, again, why doesn't everybody do it? And I go, well, some people can't qualify. And the non-Christian Science world that we deal with, people aren't blessed with your good health, quite honestly. A lot of people, when they say, I want to buy a long-term care policy, Katie, we know, okay, you just went to the doctor, you were just diagnosed with something, what's up? That's normally what we get. Nobody calls to say, I want to buy a long-term care policy, and then unless they know they've been diagnosed with something. And that's I'm talking the non-Christian Science world. So
it's really important to have some sort of a long-term care plan in place, even if it's self-funding, but that so your loved ones know how you want to receive care. If you need it, don't let this happen to you. Please have some sort of plan in place.
right.
With long-term care insurance, what it does is it really turns the unpredictable into predictable when you need care.
I used to say, don't be the Titanic, right? Okay, we took that out of there, but it's like, don't be the Titanic where you think it's never going to happen, and it happens.
And you can't get insurance when you need the care. You have to have it before you get that diagnosis or.
That's right, Leslie.
So I refer to it because a lot of times when someone calls us and they say, okay, so I want long-term care, and we kind of start to ask, and okay, I have a diagnosis. And the way that I kind of refer to that is it would be like if your house is on fire and you call and say, I need homeowners insurance. At that point,
right,
you're past qualifying.
Right. I want to double insure now that my house is burning down. How much can I get?
And quickly.
So when you've done the long-term care planning, what it does is you're not going to turn your family or friends into caregivers. They get to supervise that care instead of providing it like we mentioned earlier.
And that is a huge deal, right? I want to supervise care. I mean, I did with my dad, I did with my mother-in-law. It's so much easier when you can tell people what they need to do versus doing that yourself. It really is. It's so much easier. And here's the biggest thing, Katie, right? It's not easy to use your own money. People, I'm going to tell them the story in a minute about I think we actually had a billionaire call, but it's easier to use the insurance company's money instead of yours. It just is. So we had a call, I get a lot of calls and say, would you talk to these people about long-term care insurance? And this particular individual is a billionaire in the Bay Area, and it's a recognizable name, and we'll never say that, but I got a call from a lot of people have a lot of money, have like a handler. I don't know how else you say it, right? They have somebody that says, listen, can you talk to Leslie's got $1 billion, so I got to intervene for Leslie. So I get a call, and from the handler and one of the adult sons, the dad wanted this, they were doing this care. It was costing like almost, was it like $60,000 a month for home care, right? They had the money. But you know what the adult son wanted to know? Can we get some type of coverage for dad? I'm like, why don't you go buy the insurance company? Are you kidding me? Your father's he's got so much money he can't even spend it. And you're worried about him spending, quite honestly, $60,000 a month. I had to bite my tongue because I said, look, it's out of love that he's staying there. And that's, by the way, that's your father's money, I believe, and you're going to use it. But every time you have to use your own money, it creates animosity somewhere with somebody normally. It's just so much easier. Over the years, we've had so many people on claim, and it's insurance companies, they go, oh, I love it. My mom's got this money coming every month. We know she's going to be taken care of. So it really is.
It's really a way to protect your retirement assets and then leave more to your family and charities, especially if you don't need the care.
Okay. So, you know what, I was just going to interject here. You know, I was going back to when my son was talking about, well, what if you don't need that policy? And I go, well, then you leave more money to somebody, right? And I know we talk to a lot of people out there who are incredibly charitably inclined. And I'm always telling them, listen, we use that term leverage. Like, what's it mean? Well, if I can take 100,000 of your money now and turn it into 300,000 or 400,000 for care, well, that protects that other $300,000 or $400,000 of your money that you can now help your charity, the mother church,
your children.
Ardenwood.
Well, absolutely, Ardenwood, absolutely. But people don't think that. I'm like, well, you know, it's easy to do that if you understand that insurance isn't always bad. It serves a purpose. And I see a lot of people as they age going, Jim, I actually want to buy more life insurance. Why? Well, I want to leave more money to my children or my church. And the only caveat is you've got to be healthy enough. You can always find something out there, but you've got to be healthy enough to be able to purchase that plan, right? The money simply pays for it. Your health actually buys it.
Mhm.
So.
Most important thing, what you need to know, you can either call or email Jim or myself, and we'd be happy to help. We do not charge a fee to work with you. The insurance companies pay us for helping you if you write a policy with us.
Yes. Yep. And it's and we tell everybody that up front, right? We don't charge a fee, and as long as you place business with us, then we're able to continue. The insurance companies compensate us, and we're able to keep this model going. And I've used this model now for 33 years, and it works well. What doesn't work well, though, if somebody takes our plans and goes to their broker, that's usually doesn't help us. But that's the way it is. But Katie, we do a lot of Medicare planning, even with. We're talking to a lot of Christian Scientists right now about the end of the general enrollment period, about adding, Part B, because we know it's coming to an end March 31st. So that's important if anybody's watching this. The travel insurance is a big deal too, right? If somebody's traveling outside the United States, we always recommend that.
And then dental and vision, and we also do life insurance and annuities as well.
So again, I could tell stories forever because it happens every week. It seems like there's another story, but we absolutely love helping Christian Scientists. You can call anytime, you can email. They're going to leave our information up, I believe. And
Jim, I'd like to put in a plug, as John said, to learn a little more about the advanced healthcare directives.
Oh, please.
And why that is so important. I'm going to shift. I have setting sun here coming
the light
right
of the world.
in my window, getting right between the shades here. So having an advanced healthcare directive simply is a protection, especially for Christian Scientists, should they be presented with the situation where they're not able to speak for themselves. So whether it was an emergency situation and someone calls 911, they're unconscious, whatever, but having it already in writing, a legal document with someone designated to be able to speak on your behalf that will support your choice of care. So if that choice of care is to receive Christian Science nursing, to help facilitate that happening. So have that as part of your estate plan, no matter how old you are. It is so important. Start now. I've had mine for years, really grateful. It protects your family members, those that are with you, and it just helps when you're trying to, if you are presented with that situation, it allows that individual to make decisions on your behalf. So you're not ending up in a care setting that is not your choice.
Right. So important, Leslie. I think John always had a good example about it's important maybe to put it on the refrigerator or make sure your adult children know where it is in the event that something does happen.
And I know you mentioned it at the beginning, but you can find that on your website, correct?
It is on the website. The one that is on our website has been reviewed by attorneys in California that are Christian Scientists. And the question comes up, can you use that in other states? And I think it is a template. It has Christian Science language to it. But of course, you'd want to modify it the way you would like it to be. Have your attorney review it and just make sure that it's okay for your state. It should be universal, but.
You know what, I was just thinking, I know we're going to talk Q&A here. So if I'm a Christian Scientist and I know John has mentioned before, his scenario, but if I was in an accident or something on the streets of San Francisco and they take me somewhere, how do they know that I'm a Christian Scientist? Is there a way to?
You can have something they will look in your wallet, they will look in your ID.
Okay.
You can have a statement that says, I am a Christian Scientist. I have an advanced healthcare directive. This is my contact person. So, and make sure that person, whether it's a family member or maybe not a family member, it might be a close church friend that is authorized, make sure they have a copy of the document that they could produce it. And
to clarify, that's exactly correct. But to clarify, sometimes the EMT people it doesn't matter what you have on you.
Yeah.
They are directed to take you to the nearest emergency room.
Right.
That's their instructions. your friend can hold, or your loved one can hold a piece of paper, but often they will take you to where they're supposed to take you. The thing that is so helpful about the advanced healthcare directive is you can get out of that location.
Yes.
If you don't have that, if there's nothing stated, then it's very difficult. And we could talk a lot about that, to get out of that situation, because they don't want to be held liable. Everyone's trying to do the right thing, so we must hold to that. But by having it spelled out, and I've experienced this myself in terms of when I had a situation that not of Medicare age, but I mean, when I was taken to the emergency room because I hit the deck, and I've told this story, it was difficult to get out of there. I mean, in terms of Leslie was helpful in that process. So it's just good to have a plan. I think that's the headline that we want to convey. These are difficult things to talk about, but it's
Right.
having a plan makes them much easier to navigate.
So John, if that scenario happens, is a hospital more likely to release you, to example, like to Ardenwood, where you would be versus going home or something like that for home care, or does it matter?
It depends on your advanced healthcare directive. I know in my case, I remember I wasn't feeling well. It was just before our wonderful big event that we had here at Ardenwood. I just wasn't feeling well, and I passed out and hit the deck. And so
In a public setting.
In a public setting, I was actually at the car dealership getting my car dealt with. And so I woke up at San Francisco General, and I could see my wife and daughter, and they're talking to the woman who was the head of ER. And my wife mentioned to this individual that I would like to bring my husband to Ardenwood. She said, he's not going anywhere. And because they knew nothing, Ardenwood, they had no idea what that was. It really wasn't until Sherry had the presence of mind to call Leslie as director of Christian Science Nursing at Ardenwood at that time. Now she's director of training. That Leslie and the ER director were able to have a conversation, and she learned that we are a Medicare Part A facility. Well, that's something that she could understand. Just Christian Science care, she wasn't familiar with that. And her focus was making sure that I received the care that I needed. So you can see where everyone's trying to do the right thing. But by having that conversation, I was able to go to Ardenwood on my own, being driven there on my own recognizance. And I was here for a week and then went home healed. But you can see the situation that everyone's in. People are, and organizations want to be doing the right thing, not because they're trying to do anything other than make sure that the individual is getting the care that they need and that there's no liability. So we've got some questions here. We're coming up to a bit before 5, so maybe we can get into some of these questions, and then we will have again some time on Thursday. But grateful for these questions, and grateful, Katie and Jim and Leslie, for all that you've presented. Maybe 25 years ago, Ardenwood converted the little used 4th floor into assisted living units, but some time ago, those were closed down. Does anyone know why? Well, they are, that is our sheltered care area, which is akin to assisted living, so they are in use. Second question, if the CS facility doesn't accept Medicare, are there any other benefits that can be derived from Medicare? In other words, we accept Medicare, but other Christian Science facilities don't. Are there other benefits that can be derived from Medicare?
So if, in John's example, I'll pick on John here. So if in your example, if you didn't have Medicare Part B and they took you to the emergency room, then that entire bill you would be responsible for, because without Medicare Part B, that's the medical side, and that covers emergency rooms.
That's right.
And then Part A, if you end up either voluntarily or without your knowledge, admitted to a hospital, Part A of Medicare would help cover those costs.
And
It's interesting. Go ahead, Leslie.
Oh, I was just going to mention would be X-rays. That is, and that is something we don't do here at Ardenwood, but if someone chooses to do that, that is a very expensive process. If there's a need to set a bone, and it is tens of thousands of dollars. So
Right.
Medicare A and B can go for that.
And I can corroborate that. So this was 2012 now. It's December of 2012. So this is 10 years now. But in the time, this was a very short period of time. They called my wife, she couldn't come to the dealership. So they took me. So that was, anyway, the ambulance was $3,000 for 9 miles. And there were many tests that they ran. Bear in mind that we had full insurance coverage. We were required, in terms of our adoption, we were required by California state law to have all the insurance we need. The insurance didn't apply because we were out of network, and they didn't take it at San Francisco General. There's been many challenges in that. If you read the San Francisco Chronicle, a lot of people have been affected by this. But the short period of time that I was there, even though I had insurance, it wasn't covered in this instance, because again, I'm not Medicare age, but it was over $10,000 that we were responsible for out of pocket.
Right.
Just as I say, a few minutes, but thankfully, the conversation that Leslie had with the ER physician, they had a whole battery of tests lined up. Those tests are extremely costly.
They really are, John. As a matter of fact, I've been having a lot of conversations with Christian Scientists today. We talked to somebody in Washington, Arizona, North Carolina, and I can't remember some place, I don't know if it was Ohio or wherever it was, but they're trying to determine if they should take Part B. A lot of them, just Christian Scientists, have Part A only. My recommendation is absolutely, even if you pay a fine, right? So if I had Part B and I was in John's scenario and I'm in Medicare age, listen, if I go into that it's emergency rooms covered under Part B. And if they do some type of an incredible MRI or X-ray there too, that's all covered under Part B. I've seen $70,000 or $80,000, $60,000, $70,000 bills for outpatient, right? Outpatient under Part B covered like that. Well, listen, I would rather pay 20% of a Medicare approved rate if I have Part B. So in that example, if it's let's say it's a billed amount of $65,000 and they go, listen, Medicare gives you a break. The bill is now $50,000, but you only have to pay 20% of that, which is $10,000. I would much rather pay only $10,000 than I would $60,000 or $70,000. So even just get that Part B in place, it protects you. You're going to pay 20% of a Medicare approved rate. So when I get asked, should I get it? I'm always absolutely, I think it's important. You have to look at the fine if it's been a few years, but still, I think it's worth it. It's going to protect it. Even if you can't afford or choose not to get the supplemental plan, I really think you need to get Part B. And that's ending the 31st of this month, right? So if they haven't done it, now's the time to add it on.
Next up, you explained the policy is not valid at Christian Science facilities. Distinguish what is being provided by long-term care program versus what I am purchasing through basic Medicare and Plan and Medigap policy that I have.
Is that for us or for you?
Well, I think she's saying that because we're not registered, that sometimes long-term care doesn't apply, but I think in some instances it does apply. Leslie?
And it all depends on what the policy, if the policy mentions a Christian Science nursing facility, you're in. If it specifically says licensed by the state, we are not licensed by the state. So it all depends on what's written into the policy. If it's an older policy, some of them will have Christian Science riders. Keep those policies because you can't get those anymore.
Yes. And Leslie, I've talked to a lot of Christian Scientists out there too. And I'm always, go get your policy and see what it says. Because I've had a lot of Christian Scientists under the belief that it would be covered, and they can't find verbiage in that contract. It doesn't matter what the salesperson told you or what you think you have. If it's not part of that contract, it's not going to be covered in a Christian Science facility. It's got to have that verbiage in there. And I know you'd mentioned some policies sold years ago, they do, but a lot of people were in they thought they had it, and after we reviewed it, they found that it's not covered.
There are still some of those, we talk about the indemnity type policies. So once you qualify for the benefits, they pay you a cash benefit where they deposit it into your account. So if you wanted to go to Ardenwood or you want to pay a family member, you have the freedom to do so on those type plans.
We haven't mentioned other financial support that's available. The National Fund for Christian Science Nursing is something that can help. It does not necessarily pay the full amount of care, but it is very generous. It's National Fund for Christian Science Nursing, nfcsn.org. It's administered through the Principal Foundation. Very easy application process, and it can support wherever there's a need of Christian Science nursing, whether it's in the home, whether it is in a facility, whether it's skilled care, whether it is lighter care like sheltered care, they can help support that. So it's really worth reaching out to them. Sometimes they can fill the gap between what insurance is covering or Medicare is covering and help with that too.
Thank you, Leslie. I was just going to mention that as well. Perfect. Just a few more questions. We've come up to 5 o'clock. Let's go a little bit over. Can you still be self-employed and receive long-term care insurance?
Sure.
So yeah, you can apply for a long-term care insurance plan while still being employed.
Absolutely. Yes.
Self-employed, yeah. Next up, is there an age limit for obtaining a long-term care policy? Is there a reason Jim's mother-in-law couldn't get another long-term care policy?
Yeah, the answer is due to COVID, a lot of the ages got reduced, right? I used to see go up to age 80, for example. Now one of our favorite companies nationwide cuts off at age 69. And I wish, I talked to them if they're going to come back to even 70 or 75. And it just depends on until this COVID kind of finalized, if it ever is. So a lot of the insurance companies have reduced those age limits. And I wished my mother-in-law could get a policy. Remember, they dropped it, they canceled it. But it's like that example with Leslie said, if your house is on fire, well, my mother-in-law, she needs help with almost every activity. Her house is on fire. So there is no way that she can get any type of policy. I wish she could.
So here's another was a statement rather than a question. It says, good grief, this webinar is depressing.
Sorry. Well,
I understand. So what I want to say by that, and I mentioned that on purpose, I could have avoided that, but that's why we have a plan. And
right.
Costs are significant. And we as Christian Scientists don't really understand the costs involved because we do a good work and we are in good shape. But money is a funny thing. And as we know, and talking about the examples of Jim and Katie, we're not Christian Scientists, but certainly love what they know about Christian Science and Christian Scientists. But the family dynamics might be such that many family members aren't Christian Scientists. And if you don't have some of these discussions and conversations, that's where you run into trouble. That's where you have
exactly right.
Thanksgiving dinners that you've talked about, Jim, or the Christmas dinners that aren't the same as they used to be, because these things weren't talked about. So that's why we have these.
Right. The last thing we want to do is try and be depressing. We're trying to show you options, alternatives, right? So it's not depressing. So it's not. So you can live a long life, and if you need some like practical care, then you've got the means and you've got a plan. So the last thing we want to do is be depressing, but it's real life. I mean, that's what we do.
Yeah, we just appreciate it. And Jim, you and Katie have talked to over 1,300 Christian Scientists, probably more now. That was a few months ago.
Right.
But so we're just grateful for your good work. Let's just have 2 more questions, and then we'll save the rest of them, if it's all right, for Thursday. I understood Leslie to say that Ardenwood doesn't accept Medi-Cal and Medicaid. Can Medicare be used for care at Ardenwood?
Medicare, yes. Medicare is based on the need for skilled care. It's kind of hospitalization, whereas Medi-Cal/Medicaid is based on a financial need and tends to be more for long-term care. They're 2 completely different programs.
And Medi-Cal, once again, is the same as Medicaid in any other state in the country, but for some reason we just have our own special name for it.
Someone was clever.
So can Jim explain what he means by Part B expires March 31st, please?
Sure. So they've got enrollment periods with Medicare, and the first one is the initial enrollment period when you're first 65, 7-month window. The second one is a special enrollment period if I'm still working for a company past 65. The general enrollment period is super important to people that don't have Part B, because if I miss my first 2 enrollment periods, I can't just randomly say, well, I think it's August. I think I'm going to sign up for Medicare and I'll get it now. It doesn't work like that. Medicare says, listen, if you've missed those initial and special enrollment periods, the general enrollment period is the only time you can add Part B. And that's from January 1 to March 31st.
Every year.
Every year. But again, and it's not effective until July 1, right? But you have to do it. That's why we think it's so important when we talk about doing a Medicare review towards the end of the year, that it's important for Christian Sciences to know that, listen, there's a deadline and you can start January 1 to March 31st. By the way, I think that's why we're getting so many calls this last week I did on adding Part B, because they go, I remember that something about the 31st deal, but it's so important to get Part B. It really is, I think.
Well, that be the last word for tonight. Thank you, Jim, Katie, and Leslie, for guiding us through the ins and outs of long-term care insurance options for Christian Scientists. Please don't hesitate to call any of these three with questions at any time. They stand ready to help. And we'll see you Thursday at the same time for the answer to more of your questions. You will receive a follow-up email. Thank you one and all again for joining us today. We look forward to seeing you on Thursday and then on Sunday, May 1st at 2 p.m. Pacific for online annual meeting featuring inspirational speaker Warren Huff. Please check our website soon to register. So thank you
Everybody.
again, and goodbye for now.
Bye.